So there are a lot of arguments being made against Medicare for All, which is a single-payer healthcare system that is being basically proposed by Senator Bernie Sanders. So now that would be establishing a national healthcare system that's funded through payroll taxes. Now, at first, of course, you had the right wing using their time-tested arguments of it's socialism and communism. And then you will end up, of course, eating rats. Ridiculous. There's also the cost argument that it will cost an additional $32 trillion over the next 10 years. That's, of course, huge lie. In fact, our system right now already costs $32 trillion, or I'm sorry, $3.2 trillion a year, and is expected to increase within the next 10 years to about $50 trillion. That's $5 trillion every year. So now we've seen from reports that Medicare for All actually saves about $2 trillion per year. So now you have the Democratic Party, by the way, that come out against this. First, Kamala Harris, who said she was in favor, right? She backtracked on that issue when asked, are you in favor of eliminating private insurance? She would say, oh, yes, raise your hand if you can eliminate private insurance. Great. Then, of course, later on, her spokespeople would say, oh, no, backpedal. She didn't say get rid of private insurance. She just said she would get rid of her own private insurance. So now, after this happened, after the backpedal, and even so with Elizabeth Warren, you've seen that backpedal as well. Well, Kamala Harris lost all of her support and had to drop out, and Elizabeth Warren's been dropping like a stone. So now contrast that, you've got Joe Biden, you've got Pete Buttigieg. Now, Biden and Buttigieg have essentially been making an argument against Medicare for All. And that's the argument of choice. Oh, if you preserve private for-profit health insurance, well, then you're preserving people's choice. They should have a choice whether or not to have private insurance through an insurance company or a public government option. So now I've explained in other videos why public option wouldn't necessarily be successful. And of course, a lot of it has to do with massive lobbying and corruption inside of our system that would basically water down and eventually kill a public option and then leave us back to where we started. So now, Buttigieg and Biden, like I said before, they oppose single payer completely. Elizabeth Warren says, oh, we're going to have a public option, but we're also going to eventually, in my third year, try to do single payer. Now, again, the argument is, well, we just want you to have choice. So now it turns out that a former Cigna Insurance VP had actually come up with that argument about choice, and he had come out as a whistleblower to say, actually, in reality, that's nothing more than insurance industry basically lies, and that you don't get any choice with private insurance. So this happened in a Twitter thread yesterday. So he started off by saying this, quote, lately I've noticed some Democratic politicians, for example, Pete Buttigieg and Joe Biden, defending the current healthcare system by saying it preserves choice for Americans. As a former health insurance executive who helped craft this talking point, I need to come clean on its backstory and why it's wrong and a trap. He said, when I worked in the insurance industry, we were instructed to talk about choice based on focus groups and people like Frank Luntz. I used it all the time as an industry flag, but there is a problem. So now understand, of course, when Frank Luntz is involved, and you may know who he is, he's basically the guy that comes up with Orwellian names for policy that ends up being very pro-corporate and anti-consumer. And sometimes even anti-freedom. And the thing is that they'll name it something like, oh, no, it's the Freedom for All of Americans Act. And what it would do is make sure that the government spies on all Americans and, does extrajudicial killings or some crazy thing like that. That's the kind of thing Frank Luntz does. And so he says, well, freedom polls really well, so make sure to put freedom and choice in every policy proposal That doesn't give you freedom and choice. Okay. So that's Frank Luntz, right? So now Potter continues. He says, as a health insurance PR guy, we know one of the huge vulnerabilities of the current system was actually the lack of choice. In the current system, he says, you cannot pick your own doctor, specialist, or hospital without running the risk of incurring huge, quote, out of network billing. So now, look, anybody who's had to go to a doctor and find out that they're out of network knows the shock and horror when they, reach into their mailbox and they open up a bill and find that they're on the hook for thousands of dollars because that doctor or hospital happens to be out of their insurance network, and therefore your insurance that you pay into premiums doesn't actually cover. Now, that's insanity. You pay into your premium for insurance. Why do you not have the choice to go to whatever doctor or hospital that you want to? It really does kind of push back on the whole idea that, oh no, if you stay with private insurance in our current system, we have more choice. No, it's not true at all. So now, knowing that, they said, we set out to muddy the issue of choice. As industry insiders, we knew that most Americans have very little choice of their plan. So now for the majority of Americans that have insurance through their work, do you have a choice in which insurance company your job goes to? Perhaps if your company is, strongly unionized, you might. But odds are you likely don't have a choice. And so he says that your company chooses an insurance provider and you get to pick from a few different plans offered by that one single insurer. Usually either a high deductible plan or a higher deductible plan. Now, deductibles, of course, can run people on average about $1,500, even more. I think that's a low deductible plan because I've seen a lot higher. But what that means is that you have to pay that amount out of pocket before your insurance will even deign to cover part of whatever procedure or whatever thing that you have to use the doctor for. That's insanity. Now, compare that to Medicare for all single payer. There is no deductible, meaning you can go to the doctor whenever you need to go to the doctor and don't have to pay a massive upfront charge just to go there. So, again, that goes back to what choice do you have if you don't actually have a choice? And again, that deductible makes sure that you don't have a choice. Your choice now is, do I go to the doctor when I'm sick and have to pay that massive deductible, or do I not? Do I tough it out and save money? That's the problem here. Okay. And again, going back to the company, you don't pick that. You don't pick the insurance company if you get your insurance from work. You only get access to a couple of pre-picked plans by your bosses in the health insurance company. And then you have to choose. So again, who's got the choice here? Not you. And of course, the other thing that you have to face, I guess the choice that you have is basically trying to anticipate your future healthcare needs. So do you choose a low deductible plan or do you choose a high deductible plan? Do you know if you're going to get cancer in 5 months, 6 months down the road? You don't know. So you might pick, no, I'll go for the low deductible plan, or I'll go for the high deductible plan, and save money on my premiums, right? Well, oops, you get cancer. Now you have to come up with $2,000, $3,000, $5,000, maybe even more before you can even see the doctor. That's the healthcare system that we have. And by the way, that doesn't even mention if you have an emergency out of network and you end up going to a hospital or a doctor that isn't covered because you're having an emergency. Well, then you get a gigantic bill. This whole thing is an absolute disaster. Now, Potter continues, another problem insurers like mine had in the choice issue, people with employer-based plans have very little choice to keep it. Now, there's that. You could lose your job. Your company could go out of business. Or even though you like your insurance plan through work, your work decides, That's too expensive for us because we pay part of your plan. So we're just going to change to cheaper insurance with different plans that are obviously going to cost us less and maybe our workers more. So there's that as well. I mean, I personally have experienced that as well. I was working for a company and there was a staff meeting. This was at a plastic injection factory that made plastic car parts, inner door pieces and things like that. And the boss basically said, "Look, your kids are costing me too much, so we're going to switch insurance plans. It's going to be cheaper for me, and then we're going to have you put more in from your paycheck to save me money." That's how this system works. The companies, corporations, and the bosses make all the choices, and you end up paying for it as a worker. That's our current system. That would not happen under Medicare for all. All right. So now Potter says, you can lose it if your company changes, as I said, or change jobs, which doesn't happen under Medicare for all, or many other ways. This is a problem for the defenders of the status quo. So he's absolutely right about that. And who are the defenders? Like I said, people like Buttigieg, people like Joe Biden and Amy Klobuchar, all those, even those who say, let's get a public option. As I said before, a public option will eventually be killed by all the corruption in our system. And so watered down to the point of how it creates a death spiral in the government by being loaded up with the sickest and the poorest people, while the insurance companies have all the people who are relatively healthy that don't want to pay higher premiums. So now more. He said, knowing that we're losing the choice argument, my pals in the insurance industry spent millions on lobbying, ads, and spin doctors, all designed to gaslight Americans into thinking that reforming the status quo would somehow give them less choice, which is what we see from, again, all these supposed pro-health insurance groups. For example, an industry front group launched a campaign to achieve this very purpose. He says, it's named My Care, My Choice. Its job, trick Americans into thinking they currently can choose any plan they want and that their plan allows them to see any doctor. And he said they've spent big in Iowa. Iowa, of course, is one of the front states, for one of the first states, I should say, in the nominating process. So, yikes. Now, here's the other thing, right? So let's go back to PolitiFact's Lie of the Year. Now, Republicans love to throw this in the face of Obama. I believe it was 2014, maybe. No, I'm not entirely sure on that. But PolitiFact's Lie of the Year is Obama saying, well, if you want, if you like your doctor, you can keep your doctor, right? With the ACA. Now, of course, that's not true at all. Now, right-wingers, as I said, ironically jumped on that because, look, and the reason I say ironic is because their plan isn't any better. With their plan, it's the same thing. Is your doctor in network or out of network? Will you be able to keep your doctor if your insurance company changes, if your workplace changes insurance companies and suddenly your doctor's out of network? No, it's no different. But Republicans should, again, have been hit with Lie of the Year as well. But Obama was hit on that when it came to the the ACA. So in a weird way, of course, Republicans were kind of right. But of course, they only pointed it out because they hate Obama. They hated the ACA, which was a massive corporate giveaway. But in reality, the use of private insurance that makes it so that your doctor might not be a part of your insurance network, and therefore you can't just keep your doctor. So now speaking of the ACA, quote, this isn't the only time the industry made choice a big talking point in its scheme to fight health reform. Soon after the ACA was passed, it created a front group called the Choice and Competition Coalition to scare states away from creating exchanges that include better plans. The difference is this time the Democrats are the ones parroting this misleading choice talking point, and they're even using it as a weapon against each other. Back in my insurance PR days, this would have stunned me. I bet my old colleagues are thrilled and celebrating. The truth is, of course, is that you have little choice in healthcare now. Most can't keep their plan as long as they want or visit any doctor or hospital. Some reforms, like Medicare for all, would let you. In other words, Medicare for All actually offers more choice than the status quo. Now, that's really important because if you want choice, if you want actual freedom, then you should support Medicare for All because it's the only plan that actually gives you those things. Now, Potter ends it on this note, quote, so if a politician tells you they oppose reforming the current healthcare system because they want to preserve choice, either they don't know what they're talking about or they're willfully ignoring the truth. I assure you, the insurance industry is delighted either way. Now, I, of course, on this show, believe that they absolutely know what they're talking about, but they are paid to uphold the status quo. Giant healthcare companies give a lot of money to both sides of the aisle. For example, Pete Buttigieg, as I keep bringing up, was given millions of dollars in campaign contributions from the healthcare industry, as was Joe Biden. And look at that. Pete Buttigieg has dropped his support for single payer completely and is now using Frank Luntz and industry talking points to attack single payer. Even Warren, as I said before, she is using it to some extent, probably thanks to her, Democratic consultants and staffers. But whenever you hear that, just understand that this is a lie. It is designed to trick you into voting against your own best interest, against something that is not only cheaper overall, but is actually cheaper for you. No deductibles, premiums, co-payments, and would actually allow you greater freedom and actual choice. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.